All right, so I'm gonna go ahead and bring you in. Go ahead and have a seat, whichever one you would prefer. Alrighty, so I'm gonna go over some pre-op instructions on what to do, what not to do, and all of that good stuff. And then I'm gonna have to take your vitals.
Excellent.
Okay. First things first, you're gonna get an antibiotic. You're gonna start that the day after surgery.
Oh,
so
excellent.
Not the day of.
Okay.
Your pain medication, Dr. Bunkis is big on not really doing narcotics. He will if he needs to, but you're probably gonna get like a non-narcotic for pain medication. If you take any anticoagulants like aspirin, Excedrin, stop 2 weeks prior because they are blood thinners. So then you won't be able to clot, and then it's just a mess, and then healing takes a little bit longer. No eating or drinking 8 hours prior to surgery.
Yes, ma'am.
Make sure you have a ride to and from because
Yes.
you will be under general anesthesia, and we don't want you driving, getting into a wreck. Make sure you have somebody. Do not wear makeup, piercings, none of that. Leave all your jewelry and valuables at home. All right, so I'm going to get your vitals, your blood pressure, and your pulse. That's important because if it's too high, surgery can get canceled.
So you decided to go ahead.
Yes,
I'm glad to see you here.
I am as well.
Can you tell us, in your words, what we're going to do procedure-wise?
Yes, I am going to have a facelift.
Mm-hmm. And what does that entail?
It entails having anesthesia,
Mm-hmm.
and it entails being wrapped up afterwards for 2 days.
Let me just go over the procedure itself.
Excellent.
Right?
Okay.
Don't trip, stand up.
Yes.
And come over to the mirror. And as you're looking in the mirror, what we're going to do is make an incision. You saw my officer manager, Jojo. It starts right behind the sideburn, goes down this little part around the ear, and goes behind the ear and goes off into the hair. And you have another incision about this long that goes underneath the chin. In patients who don't have that nice beautiful chin that you do, we use that incision to put a chin implant in. But for all facelift patients, what we're doing is getting access to the neck. People who have fat in there, we section it out before we start doing the surgery, right? But in everybody, once we make that incision, we lift the skin off, we sew the muscles together. See these bands that you can see there?
Yes.
We sew them together this way.
Oh,
okay?
excellent.
As tight as we can.
Yes.
Then through these incisions, we tunnel down underneath the skin, we lift that muscle up, and the skin gets redraped, and this is roughly what you're going to see when we're done. You see that this fold does not change, and you still have a little bit of looseness here. Okay, you can't pull it hard enough so that otherwise you're going to be like this, you won't be able to make any expression. So this is roughly what we expect. See that?
Excellent.
And then for the lower lid, we're going to make a little incision inside the lid. Take this fat out. When you're done, you're going to be flatter like this.
Lovely.
Okay, have a seat. I see that you filled out all the paperwork.
I have.
You filled out the anesthesiologist form.
Yes.
We have all these consents forms that we ask you to sign because we don't want you to be thinking about it on the day of surgery when you're a little bit nervous. We take care of all of that in advance.
Okay.
There'll be 1 or 2 forms to sign when you get there. But today we're basically going to go over the pre-op instructions, the post-op instructions. I'm going to listen to your heart and lungs because I've seen your labs already and they're all good. Okay? Before surgery, the only thing you have to avoid is the list of things that causes your blood not to clot well. Medicine-wise, aspirin and Advil. If you have a headache, if your ankle hurts, if anything hurts, you can take all the Tylenol you want, but do not take aspirin or Advil for those last 2 weeks. Be careful about some combination medicines that they use for colds and headaches and period cramps and stuff. If you read the label, it might have aspirin in it or Advil. Don't take those. If you have any questions, call us and we'll tell you if it's okay to take. Okay? There are some supplements that people take. They're very, very common, and if you're not having surgery, they're very good for you, like fish oils and vitamin E, for example. If you take those, they affect the platelets in your blood, and you're way more likely to bruise and turn purple. So Jojo will give you a list of supplements that we absolutely want you to avoid. If the supplements you take, like calcium and vitamin D, for example, if they're not on the list, take them to your heart's desire. If you don't care if you take them or not, just don't take anything for 2 weeks before surgery, except for Tylenol kind of a thing.
Excellent.
The day before surgery, you can have an absolutely normal meal. You can have a glass of wine or whatever you normally do with your meals. When you go to bed at night, if you wake up in the middle of the night, when you wake up in the morning, do not eat or drink anything except for prescribed medications. If you have a blood pressure pill or heart medicine or something else that's given to you by a doctor, you can swallow it with a sip of water.
Okay.
But don't finish the glass. You can brush your teeth, but don't drink the glass of water. Come in with an empty stomach. If you fill your stomach with water, there's a danger of aspirating as you're going to sleep or waking up. And the anesthesiologist, if he knows that you had a glass of water, won't put you to sleep. Then you're going to have to move your case to a different day. So come in with an empty stomach.
I'm very clear on that.
Someone has to drive you home.
Yes.
Someone has to drive you here. And an adult has to stay with you for the rest of the day of your surgery. The next day, someone has to bring you back here, and we're going to take your dressings off. There's a little drain behind your ear. We're going to take that out the next day.
Okay.
Then when you go home, I have no problem with you staying by yourself because your head is perfectly clear and you can put on your own ice packs. You can deal with things yourself. If you have a friend who will stay with you for a couple of days, enjoy it for social reasons, but it's not medically necessary. What you're going to do the day after surgery and the day of surgery for those 2 days is park yourself upright, not in an uncomfortable chair like this, but something where you can lean back a little bit. Take a face cloth, moisten it, wring it dry, lay it across your eyes, and put a pack of frozen vegetables up there. Peas, carrots, corn, I don't care what, whatever's cheapest that day. Buy 2 of them, one for your face, one for the freezer, and all day long just keep rotating them. As one starts to get a little soft, put it in the freezer, take the other one out, and keep your eyes cold. You can take it off.
So you're telling me to put it literally on my eyes?
Yep. That's why you
Excellent.
put a face cloth on first so you don't freeze your skin.
Got
Okay?
it. Thank you.
You can take it off anytime you want to go to the bathroom, to go eat something, to stretch your legs, to change the channel in your radio or your TV or something, but don't watch TV. Okay, you can listen to it all day long, but just don't watch.
I
Just ice
understand.
as much as you can. This is not a day for Instagram. This is not a day for Facebook. This is not a day for answering emails. Just ice and chill. Okay? After 2 days, ice doesn't help anymore. You will not have any dressings on after the second day. You can shower, shampoo, wash your hair. You can do absolutely anything that does not hurt.
Okay.
You can walk 6 miles. You can work in your kitchen. You can work in your yard. You'll have visible bruises for about 10 days or 2 weeks. And most people hide out during that time. People who work for themselves at home on a computer, usually by the 3rd day they're working again because they don't hurt, they can see, you know, they look bruised. But you can get back to your normal routine as soon as everything is comfortable for you. And for most people,
Excellent.
bruise-wise, it takes about 2 weeks.
2 weeks.
Okay? The incision underneath your chin will have a little piece of tape on there, and you don't have to touch that. The incisions around here do not have any tape on them. There are 4 or 5 sutures that I remove at about the 5th or 6th day.
Okay.
But otherwise, all the rest of the sutures are all buried and they dissolve. So they just go away on their own.
Okay.
Do you have any questions about anything about the procedure, before care or after care?
You've been very thorough.
Let me listen to your heart and your lungs, and then we'll be kind of done with the pre-op, and we'll take it from there. Okay, you sound pretty healthy. I don't have any more questions. I'm going to bring you out to JoJo.
Okay.
And she'll finish giving all the instructions from her end. But if you have
That's
any
exciting.
questions, you have my cell phone number and you have my email address.
Yes.
If you are not in a hurry for an answer, email me because I answer them every day.
Okay.
If you are in a hurry for an answer during work hours, during the day, please call the office number because
Okay.
I don't carry my cell during the day.
Mhm.
Nights, weekends, you can call me any time on my cell. I sleep with it. I have it with me all the time.
Wow. That's amazing.
We'll take good care of you.
Thank you so much, Dr. Bunkis.